You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the Pharmacy Podcast Network's exclusive coverage of the 2025 American Pharmacists Association Annual Meeting and Exposition, held March 21st through the 24th in vibrant Nashville, Tennessee. This year's theme, Igniting Inspiration, set the stage for powerful conversations, bold ideas, and the renewed energy driving our profession forward.
In this special three-part series, we sat down with leaders, innovators, and frontline pharmacists to explore the current state and future of pharmacy. From workforce challenges and clinical advancements to policy, technology, and public health impact, these interviews shine a light on what's fueling the next era of pharmacy.
This series is proudly sponsored by PharmaStaff, your pharmacy workforce partner, and You're All Pharma, advancing access to high-quality generics across the U.S. Let's dive in and hear directly from the voices shaping the future of pharmacy.
This year's press coverage of the APhA 2025 was sponsored by PharmaStaff. Introducing Sattarov, Vice President of Operations at PharmaStaff, who sat down to talk with Todd Urey during the exhibition.
Sattarov is back here at the APhA 2025. PharmaStaff is one of our sponsors for this content, for this three-part series. This is an important topic that we're talking about. Donnie, welcome to the show.
Thank you, Todd.
All right, so clinical is the heart, the safety of people, the safety of our public. It's the pharmacist that's keeping those people safe. It's the babies that are taking medications and their weight is being monitored by a pharmacist in the dosing, and specialty pharmacy and the disease state management is very complex, or long-term care and geriatrics. I could go on and on and on. The clinical aspect of pharmacist is the secret sauce of our pharmacy care. And then I think of all these other roles that surround a pharmacist in operations that don't necessarily need a pharmacist to do them. I'm talking about data entry. I'm talking about follow-up. I'm talking about customer service. I'm talking about documentation oversight and making sure that things are spelled right and it's put in the system the right way. Donnie, talk to us about how PharmaStaff has evolved and how you're starting to add in special positions to support pharmacists becoming more clinical instead of focusing on some of these administrative tasks.
Sure, Todd. So first of all, to start with, pharmacists should not be operating on any administrative tasks. It should be It should be a person who's not a pharmacist. Pharmacists should be only on clinical staff, such as advising the patients on their medication dosages and making up the medications in the pharmacy as well. We as a pharma staff, we take pretty much a huge chunk of work from the pharmacy's shoulders into our end, such as administrative tasks such as data entry, insurance verifications, prior authorizations, inbound, outbound calls, and any other tasks that are in the pharmacy depending on their operation, obviously, right? As of now, we all know that most of the independent pharmacies, they're so low on their profit rate because they use pharmacists that they pay so much to just simply to do data entry, to reach out to the patients that they should not. Yep. This is where the pharma staff comes in terms of helping them reduce that cost to a minimal cost that's available in the market, where the most affordable outsourcing, specifically in the medical field, and to take care of those tasks with the higher quality that's been done by the pharmacists. Yep. Because keep in mind, our people are specifically trained and designed to do that job, rather than pharmacists that's doing 5 tasks at the same time will do it with a much poorer quality than we would.
Yep. Something else that you and I were talking about that really got me interested, and we're going to talk more about this on the Pharmacy Podcast Network. If there is a program that is a profitable program for our community pharmacists, and I'm talking about durable medical equipment, I'm talking about diabetes management plans or lifestyle management plans that start dialing into supplements. Listen, pharmacists and pharmacy owners out there, if you have these programs and you're saying, Now, how do I get them off the ground? How do I get to market them to patients that already trust me? If your pharmacy is called Maple Street Pharmacy, and everybody knows that Maple Street Pharmacy is your community pharmacy, and you have a diabetes management program, and who's telling you about it? Well, you could put it in the newspaper, or you could take a big ad out on the news for cable, or you could hire a PR agency and whatever. But if PharmaStaff knew who your patients were, they had email addresses, they signed a business agreement, an NDA to, making sure that it's managed the way that you want it managed as a pharmacy owner, and now the pharmacy staff marketing team starts reaching out to your patients, like, that's brand new money. That is brand new compensation and revenue that's coming into that pharmacy. And now PharmaStaff starts getting to know your operations, so they're saying the right things, so they're personalizing the messaging, and then they're bringing more money and more revenue and new patients and reasons to your organization.
Absolutely.
So talk to me about that. How would that work if we had a diabetes management program, or a lifestyles management program, or even if we wanted to sell supplements? There are NDCs out there, drugs out there that might deplete a calcium or might deplete vitamin E. And if you had people reaching out to patient base, either through email or newsletter or even phone calls, talk to us about how a pharmacy might use PharmaStaff for marketing.
Sure. With the PharmaStaff, you're not only limited to the current workflow of the pharmacy internally, so meaning not only serve that the business that you already have in the pharmacy, but we are available to bring you more business into your pharmacy from the outside as well. Most of the pharmacies they don't take full advantage of all the data that they have.
Yep.
All the purities in the data that they have. So if they have, let's say, a couple thousand patients that they've served for over a last month, and those patients are diabetic, those patients been on different tirzepatides, those patients are available for us as a PharmaStaff agents to reach out to them and to offer them any additional supplements, or to offer them any additional refills,
Yep.
or to pretty much get a new business from their end, right? Most of the pharmacies, they are so tied up with the administrative work that they have currently in their pharmacy that they are not really open into bringing new business as they should. The idea of the pharmacy themselves is not to be so into the administrative work, to let us handle it and let us bring more business for them to serve them.
Yep. And it's the custom training that PharmaStaff is doing with the individual pharmacy that they're dialing into your workflow. They're dialing into your pharmacy management system. They're really mapping workflow that matches the operations. And then you're going to start bringing more creative things in, maybe to actually expand business.
Yep,
so
absolutely.
It's an ongoing relationship. It's not just a one and done. It's not just, data entry or billing support or customer service. You can keep layering how PharmaStaff can help grow a pharmacy.
Exactly, and we have pharmacies that we worked with for over 5, 6, 7 years and it's just been great. They've just been expanding, and this is in our interest to make sure they're expanding as well.
What about specialty pharmacy? When I think of specialty pharmacy management and disease state, I think of geriatrics, and I think the specialty things that are happening in the geriatric world. I think there is an opportunity for pharmacists and pharmacy owners to get involved with PharmaStaff and reach out to those organizations. Maybe a caretaker needs to be updated on something. Well, does your technicians have time to do that?
Of course. We have technicians for anything that you would think of, right? Starting with something simple as just a data entry and reaching out to the patients, and going in with something a little bit more harder on advising the patients on how exactly their medication should be taking, on the dosages, and on the next refill dates. So anything that pretty much would come into your mind that could be outsourced, that's where we would come in and set up a best remote employees for your pharmacy.
All right, let's talk about return on investment. So I'm a pharmacy owner, I'm a pharmacy operator. I want to realize if I'm spending X number of dollars, what's my ROI on that?
Usually it's it's between 60 to 80% ROI, but the median is 70, obviously depending on what positions do we fill, but it doesn't get better than this.
It's incredible. All right, so a shout out to the pharmacies that you're working with. Give me an example of implementation. I want to hire PharmaStaff. What's some of the steps that I would take to get involved?
Our usual implementation takes about 3 days. So the first day is the setup, where we would get an access to all the required data that we need, either to connect to your current PMS systems, whether it's PrimaRx, Pioneer, Liberty, SuitorX, McKesson, any of the PMS systems that would come into your mind. So we would have an access of your PMS system remotely. The second day is for us to get to know your system, and the third day is for our PharmaStaff team to better train on what exactly needs to be done. So it's usually 3 days to just set up everything and get it going.
PharmaStaff.com. Once again, it's PharmaStaff.com. I want you to reach out to the team at PharmaStaff. Tell them that you heard about this at the APhA 2025 post-show. Donnie, we have more work to do. Can't wait to have you back on This Week in Pharmacy.
Thank you, Todd.
We'd like to thank our press coverage sponsor, PharmaStaff. The pharmacy industry is changing. One of the most expensive aspects of your business is payroll. With all the challenges you're experiencing running a pharmacy business, have you thought about reducing the cost of your staff by up to 75%? PharmaStaff provides outsourcing positions to handle patient customer support, prior authorizations, incoming calls, update databases, and any other tasks you require. At PharmaStaff, your health information is secure and exceeds in compliance standards by implementing even stricter safeguards to protect your data's integrity and confidentiality. Schedule an appointment today with PharmaStaff and learn how your pharmacy operations can scale your key administrative positions inside your pharmacy at a fraction of the cost. Contact PharmaStaff today by visiting their website. Go to pharmastaff.com. That's pharmastaff.com. Let them know you learned about these incredible people resources from the Pharmacy Podcast Network.
I'm here with Dr. Athena Cannon, PharmD, and she is with the Indiana Health Board Medical U.S. Sports Pharmacy. And it's a network that you're creating, and there's standards involved in that, right?
Absolutely. So the U.S. Sports Pharmacy Group was informally created in 2020. It was out of my interest back in 2016 to be involved in pharmacy and also understanding the pharmacist role with athletes. So after 4 years from 2016 to 2020, I was able to meet other people with a similar passion, similar questions, people working in the field. And so we were able to create this group back in 2020 of pharmacists and students and researchers that had a shared passion. In 2022, it was founded as a nonprofit in the state of Minnesota. And now we're here in 2025. And we've got, again, pharmacists, researchers, students, some technicians across the United States and internationally. And really, sports pharmacy has been around for a very long time internationally. So by no means are we necessarily, creating everything new that is within sports pharmacy. But we're taking what other countries are doing and what our members internationally are doing, and we're bringing them to the U.S. because our sports landscape is very different, right? And so that's the exciting part about what we're doing, not necessarily creating everything, but growing it.
All right, so it's the infrastructure for something that's growing in the United States, finally.
Yeah.
And people like Dr. Brandon Welsh and Dr. Jessica Beal, they're the ones that are getting a lot of attention for digging down into the roots and the channels and helping the athletes and talking with the schools and talking even with the NFL or, big. So pharmacists in sports, I think of the infrastructure that you're building, the standards that you're building, the common knowledge to pass on to another provider. Talk to us more about the formation of the organization.
Yeah. And I love that you're bringing up the standards because I think, as a nonprofit, what we do is to help everybody. And of course, we have members that we can really get to know personally, understand their goals, and provide them with resources so that they can move forward in their local communities. But what we hope to do is help everybody in pharmacy, no matter what organization they're in. And so one of the big task forces that the USSPG had, which Dr. Jessica Beal served alongside me for, was defining sports pharmacy. And so that was a big thing that we were able to launch, onto our website just to get the word out there. back in February. And what we did is we spent with Michael Kessler, Marvin Wilson, some of our international members, hopefully I'm not missing anybody, Clément Lechat, who's a student pharmacist with us. We as a task force went through publications. We interviewed experts internationally and within sports pharmacy. We got perspectives from community pharmacy, academia, AmCare, hospital, and we crafted a definition for sports pharmacy to hopefully unify sports pharmacy as it grows. This definition is public on our website. We also used parts of the definition to amend or submit amendments to APHA's 1986 Performance Enhancing Drug Policy to kind of broaden what the role of sports pharmacists look like, and just pharmacists in general who might not identify as sports pharmacy, to make sure it's not just about anti-doping. It's about all the clinical work that we do and comprehensively assessing medications. So we've got a lot of initiatives, but I would say to unify all actors in sports pharmacy, the definition has been very impactful. And as pharmacists are moving into athletic programs, into working with sports teams, into anti-doping, which is where my specialty is, they're able to look back at this definition and give it to other interprofessional team members. So they don't have to stumble of, do we have a role, do we not have a role? Now the answer is yes, and they can give them something tangible that other people can digest and comprehend.
So the international that's a big deal. I think right across from our booth at the APHA is the FIP, the Federation of International Pharmacists. So here in the United States, we have NABP, which is the boards of pharmacy. So how are you working with the NABP to show them that you have standards to assure anti-doping policies are, done the right way, or so many things that could come out of it? Because I think of the new topical pain medications that have CBD, and even some of them have like a THC in them, and that might throw a flag of some sort of issue or something. Whereas the more research and the more refinement. So how do you tie it into organizations like the NABP?
That's a great question. And I would say, in pharmacy, while I've just kind of shared a lot of the wins that we're having, we go day to day with having questions from other pharmacists or other organizations about how impactful is this? How many people are we talking about? Should we put resources forward when it comes to sports pharmacy or working with athletes? And it's still a question, right? Because pharmacists are slowly stepping into this field. We aren't necessarily able to give those quality measures that we might in an AmCare clinical pharmacy setting. And so a lot of it, I would say, is, they're waiting to see how many pharmacists get involved, how many people are we reaching. And to be quite honest, a lot of the questions come from just not having the knowledge about the intricacies in working with athletes. And so, one thing that we navigate and that I navigate in my consulting is, if you look at the sports pharmacy definition, it's broad. It tries to capture everything, because we don't know what sports pharmacy might look like in 10 or 15 years. At the same time, an NCAA athlete has different rules and regulations than an NFL athlete, or a high school athlete might have different considerations. So it's hard to say this is what all athletes should follow. It's very individual. With my consulting with Drug-Free Sport, our clients, we've got a variety of clients from UFC to CrossFit to NCAA. They all have different rules, right? Some ban cannabis, some don't. Some require therapeutic use exemptions in this manner. Some have medical exemptions in a different manner. Those are the intricacies that I think, again, we're trying to spread awareness that pharmacists have a role because of this entire process. If you've seen, we'll take the World Anti-Doping Agency's prohibited list and code, for instance, it's about, 12 pages of medication ingredients. There's 9 or so different classes of medications that are from insulin, beta-2 agonists, diuretic. So things that we use on a daily basis that pharmacists don't know or aren't aware yet, that if they are working with their, neighbor, for instance, who is a recreational athlete, maybe in their 50s, and they're going and they're competing at a sanctioned event, and to them it's just a hobby, but maybe they'll get drug tested. They don't know that their antihypertensive might flag as a prohibited substance. So again, I think we're hoping to answer those questions of, some of these larger organizations by bringing them awareness, starting with the definition, and then diving in with all of the intricacies. So again, my expertise is in anti-doping, but we've got members of the U.S. Sports Pharmacy Group, Omar Hajmusa, for example, who is really trying to understand recreational anabolic use. In pharmacy school, we don't talk about that often. We don't necessarily know about cycling. We don't know, unless we're looking on Reddit, right, in some of these threads, where they're getting it, what side effects they're having, what counseling points do we need to consider if we have somebody who's not tested, still an athlete, maybe they don't want to quit. What does that look like? So, I'm excited to see all of these pharmacists, members of the USSPG or not, grow in their niche to help educate all of us as we move forward with sports pharmacy.
It's incredible when it's the expansion of the purpose of pharmacist and the role of the pharmacist. So this is actually building more opportunity for us in the future.
Absolutely, I hope so. And I mean, to be honest, Dr. Jessica Biel and I did a talk yesterday morning. It was great. It was a TED Talk. It was short and sweet. It was, kind of painting a picture of what athletes face question-wise, whether they're taking propranolol for anxiety or whether they are using an energy drink and aren't quite sure what's in it or how it's going to affect their performance. We were able to, define sports pharmacy for the audience and then leave them with a question to say, if no matter who you're working with, family member, you're at a community pharmacy, it's a neighbor, it's a patient, and you find that they're an athlete in any level, middle school, high school, college, recreationally, ask them, do you know how your medications affect your performance? And again, we're not just focused on drug testing, because not all athletes are drug testing, but we're focused on how is your beta blocker, for instance, going to affect your drive, your feeling of focus, your energy levels as you are on the line and about to go in whatever sport you have. So same with dietary supplements. How are your dietary supplements helping you or impairing your performance? And again, so it's not just anti-doping. It's not just typical counseling that pharmacists are experts in, but it's looking even further. We're thinking about performance, and we're thinking about safety, and we're thinking about long-term health. Dr. Jessica Biel will tell you that, sometimes athletes' careers are short, and we want them to perform at their best, but what happens when they're done? And we want to make sure that we're prioritizing their long-term health too.
Athena, thanks for being part of the APHA 2025 post-show here in Nashville. It's great to see you.
Yeah, thank you so much for having me.
Dr. Michael Schuh here at the APHA 2025 post-show coverage. This is an exciting event. Michael, we have been connected through LinkedIn for a long time. I've never had a chance to talk to you, so thanks for doing this.
Good to be here.
All right, so give me a rundown. What's happening in our profession that you feel is important for our listeners to really be tapped into?
Well, I think that we've long expressed maybe too much attention to product and selling a product instead of services. So we're clinically trained. We are clinicians and trained, so we really need to, I think, pay a little bit more attention to that. We need to pay a little bit more attention for offering our services and getting paid for those services, because eventually you're going to see a lot of the dispensing functions go away. We have AI, we have robots, we have a lot of things we can do, and in particular in the state of Florida, we have legislation trying to do away with pharmacists in retail pharmacies. So there's some important things out there that we need to move as quickly as we can to stress services, the services we can provide universally to institutions and to patients. But we never are going to be totally away from product, but we have to really stress other things other than dispensing medications and that side of what we do.
Product application is part of it, and being able to dial in and coach what the next steps are. So when I think of the geriatrics world, and I think maybe Uncle Ned had 3 physicians over the last 10 years, and now he has 16 medications that really we haven't tracked. Now all of a sudden a pharmacist steps in, titrates down to 9 medications, starts putting in some new supplements because maybe your vitamin D is low or something. Therein lies the precision medicine side of pharmacist care that really didn't have anything to do with the dispensing as much as it did with the consultancy.
And that's true. That's exactly what we do in our practice, which I'll be talking about today at 4:30 this afternoon on the Farm Talk. That's exactly what we do, and that's exactly where you can do this anywhere. If you're a pharmacist, if you're in a retail setting, you can have your own private practice. You can do all of these things. You just have to have the gumption to really get out and do it, to keep up on your CEs, to keep up on your skill set, where you can talk to these things. And of course, you might have to subscribe to some references and so forth for some of the more complex cases. But you can do this, and you can do it in alliance with our physician colleagues, where it works quite well if you can team up with physicians where the physicians may not have time to do these things, but you can do subscription services to physicians' offices if you like. You can do subscription services to patients, and then you do like a medication therapy consult once a year with them, and you can address all of these things. A couple of the gorillas in the room that I talk about frequently are herbal supplements, like you mentioned, and cannabis products, which are out there all over the marketplace, where there's a lot of people that are selling them, a lot of people that are out there pushing these products, but are they right for you as far as individualized medicine? And that's where we come in as pharmacists. Does a patient really need this? Or if they are using this, is this going to be an issue? And pharmacogenomics is another thing that's coming into play, but that's not something unto itself. It's really just a tool to use with some of these other things to make what we already do, to make it better, and you can find more specificity to the reason why somebody may have a medication-related problem. Is if they're using cannabis, which we kind of treat like an herbal supplement because they use the same metabolic pathways, they interact with each other, and they interact with prescription drugs. These are exactly what we were built to do as pharmacists, and we can take all these different physicians and all these different aspects of patient care when it comes to medications or anything that they take that's on the market out there, and we can combine all of these things into a single consult, and we can look for these medication-related problems, make recommendations, or if we're working with like a collaborative practice agreement with a physician's office, we can actually use that with our physician colleagues, work together, and we have a perfect storm of care between the two where we can work together and create the best care for that particular patient individually.
Dr. Michael Schuh, thank you so much for participating in the APHA 2025 post show.
Thank you for having me, Todd.
Dr. Nicole Pezzino is here with me at the APHA 2025. Nicole, it's so good to see you.
Yes, it's great to see you too.
So the last time we had you on was APHA 2024, right?
I think so, when we jumped together.
Yes, the famous Nicole jump, the joy jump, the jump of joy.
I love it, the jumping pharmacist, and you're going to be doing that with me right when we're done today.
Exactly. All right, so you've had some changes in your life. You were in academia for some time. You've done an amazing leadership in that. You've been involved with PPCN, the expansion of CPSN in the state of Pennsylvania. Share with us what's going on in your life now.
Yeah, thank you for asking. So yes, I recently pivoted away from academia, and now I'm currently working over at RedSail Technologies as a clinical consultant. So I get to have the opportunity to help pharmacies with their clinical programs, and also there's some services that we're able to help support pharmacies with helping with cash pricing of their medications.
Back in the day when I used to sell complex pharmacy management systems to organizations that weren't used to shifting workflow and then applying clinical programs to it, that was a missing piece of what we needed, and this was back in 2004, so it wasn't really thought of back then. The word workflow wasn't even like a sexy thing in pharmacy until like 2012, 2016. So talk to us about how you're dialing into the pharmacists that are involved with clinical management and applying that to a system that really helps to organize it.
That's a great question. And that's, I think, one of the neat things about utilizing like a technology company and how I'm working with RedSail is we have all this data to help support our pharmacies. But then also you have to keep in mind that our independent pharmacies are unique. They're what makes them, I think, so special. I always say that community pharmacies serve a community, right? And so they're taking care of this community that they're in. And they've done such a great job over the years of developing all these really strong relationships with their patients. And every time I talk to a pharmacy on the phone now, I always hear like the patients coming in with their relationships. And sometimes even when I'm overhearing, I'm like, oh my gosh, you can get reimbursed for that now, depending on which state you're in and what opportunities you have. And so I'm able to connect them with maybe CPESN or maybe getting some payer programs in Pennsylvania and say, hey, have you thought of, or what are your thoughts on this? Or how can we implement and how can we support you with vaccines, and how can we help boost your vaccine opportunities at your pharmacy so you can more easily and better identify vaccine eligible patients at your pharmacy, or people who you can get reimbursed for doing these clinical services and get reimbursed for those. So a lot of opportunity to really help support our community and our independent pharmacies with things they already do.
Yeah.
It's just now figuring out, okay, how can we help support them, document, train to help support them, because we didn't learn that in pharmacy school. I'm a new grad, right? You laugh. But I didn't learn that in pharmacy school. In pharmacy school, I learned soap notes that were 20 pages long.
Yeah.
Who's reading that?
I know, nobody.
So we have to
Nobody
figure
wants
out, yeah, no, me either. And I was in academia and I was supposed to be grading them. So we have to figure out efficient documentation within like where, and meet the pharmacies where they're at.
All right, you told me something before we started recording about a new certification that you've come up with that has something to do with diabetes management and the technology and the glucose monitoring. Like, talk to me about that.
Yes. Oh my gosh, I was starstruck. I got to work with Diana Isaacs. I don't know if you know her.
Yes. She's been on our show before a long time ago.
Incredible, right? And so her, myself, Lindsay Miller, and a team of people from APHA worked together for almost 2 years now to put together a certification with APHA for continuous glucose monitoring. So we just delivered our inaugural live certification.
Congratulations.
Yesterday with over 45 people in attendance. And so during the presentation, we were all able to actually put on a CGM. I put one on with them. We walked through it. So you can have like the experience of what a patient might have. Talked about barriers, and now they have their certificates after 12 hours of CE, and we're really excited and proud of what we were able to put together. I'm really proud of the team that worked together on that one.
If listeners are listening and they're like, wait a second, I didn't even know about that because it's that fresh, where do they go to get that certification?
Great question. So APHA, if you go onto their website and you go down to the certifications, there is an online portion, and then there's 4 hours of live CE. I don't know when the next live one will be offered yet, but hey, if the demand's high, I'm sure we'll have some more of these opportunities for everyone.
Absolutely. We're going to stay in touch with you. I'd like to hear more about the technology platform of you helping with implementation. I also want to get involved in some of the grants that you're helping to pull in, because we need to get that messaging out there. We need to do more public relations and business development through it. But it's been so wonderful to see you, and thank you for being on the Post Show.
Thank you for having me again. I guess I'll see you in 2026. LA.
Yeah, it's time to jump. Jump for joy.
Here we go.
Here we go.
Here's a special interview with U.S. Representative Buddy Carter, serving Georgia's 1st Congressional District, with updates on PBM reform.
Hey, we have a special guest on the 2025 APHA Post Show, Buddy Carter from Georgia. It is so good to see you.
It's so good to be here. It's so good to be around such great professionals, and a profession that I've been blessed to practice in for many, many years, and I'm very, very proud of.
Buddy, I'm proud of you because you're bringing pharmacy knowledge and pharmacy ownership knowledge to Congress and to educating other politicians of how the lack of pharmacy is detrimental to public health in communities across the country, not just Georgia. And you've become a mouthpiece for the relevance of how pharmacy care is so important to public health.
Well, it is. And you know, when you think about it, regardless of what party you may be in,
exactly.
Republican, Democrat, or Independent, we all want the same thing when it comes to health care. We want accessible, affordable, quality health care. And accessibility is so very important. 87% of all Americans Americans live within 5 miles of a pharmacy. Pharmacists are the most accessible healthcare professionals in America. That's why we need to keep this profession going, and we need to use it to the top of its license and utilize all the various services that are available through pharmacy.
So what's the importance of being at the APHA for you and you being able to talk to other pharmacists, pharmacy owners, people in hospital system pharmacy? Talk to us about being part of the APHA.
Well, it's very important to get out here and make sure they understand, first of all, that that we're in Washington and that we have a presence there, and that how important advocacy is. You know, boots on the ground, making sure that that you're getting the message out there to members of Congress. Remember that Congress is a citizen legislature. You know, I'm one of 2 pharmacists in Congress. I used to be the only one. Now I'm just the oldest one. But nevertheless, you know, we need to educate members of Congress as to exactly the value that we bring to healthcare, because we do bring value to healthcare. If you look at the pandemic that we just went through, I was so proud of our profession, the way that pharmacists stepped up, vaccines, counseling, all the things that we did, testing, all the things that we did to help America recover and to get through that pandemic. I would submit to you that no other health professionals stepped up to the plate like pharmacists did.
It's incredible. I want you to kind of give a shout out right now to pharmacy owners. Talk to me about pharmacy owners engaging their state representatives to educate them about what they're actually doing through strip dose packaging, through technology, through appointment management, through adherence. Like, talk to us about what's your advice to pharmacy owners out there?
Well, my first advice would be to hang in there. I know it's tough now, but help is on the way from the federal level. But the state level is so vitally important. And we've made so much progress at the state level. I'm so proud of states like Arkansas, like Georgia, Kentucky, states that have done so much to move our profession forward and therefore to move healthcare forward.
Yep.
That's the key, and it's so vitally important to our patients. You know, we talk about rural areas and the need for healthcare services in rural areas. We also have urban deserts where we need help, and that's why it's so vitally important that we make sure that pharmacists sustain and that we're part of the healthcare system.
Buddy Carter, we support you. We applaud you. Thank you for fighting for us. Thank you for fighting for our profession.
Thank you.
One aspect of the APHA that I like is when we're talking about technology and how important technology is the future of pharmacy. And one of the platforms that I had an opportunity to work with was the OmniPod platform. Dean Muensterman, welcome back to the pods.
Thanks, Todd. It's great to be back.
It's great to see you. All right, so give us an update on the OmniPod. I was fascinated by the technology. When we did a series with you, we really dug into how pharmacists are utilizing the technology. Give our listeners an update on OmniPod.
Yeah, you know, our flagship product is still the OmniPod 5 when we last spoke, but I think what's changed or what's evolved, if you will, is the role of automated insulin delivery technology as a whole in the industry, and OmniPod 5 being an automated insulin delivery system. We are the #1 prescribed AID system in the market. And as you well know, we would not be where we are in terms of delivering technologies if it was not for our pharmacy partners, because that's how we're delivering our technology to patients. So we're so happy to be here at APHA for that reason.
Great. You brought a partner with you. You brought a pharmacist with you. Introduce us.
Yeah, this is Matt Freitas. He is our resident pharmacist in our medical affairs department, and he's here to help make sure that we're representing well.
Matt, welcome to the show.
Thanks for having me.
All right, what pharmacy school did you go to back in the day?
I went to Massachusetts College of Pharmacy up in Boston.
Okay, and are you from Boston?
I'm from Rhode Island, actually, so close enough, only an hour away.
So, have you ever been in Nashville before? Is this your first time in Nashville?
This is my first time in Nashville.
Isn't it nice?
Yeah.
I'm impressed by Nashville myself.
Yeah, Nashville's a cool town.
What about APHA? How many of the APHAs have you been able to go to?
Oh, I went to one APHA as a student, and now I'm on my third as a post-student. So I've been here, I guess, 4 times now, yeah.
There's a mixture at APHA that I don't get at other pharmacy conferences. When we go to like NCPA, we're really concentrating on community, or NASP on specialty. But this is like we get a mixture of all of them together all at one place. That's my favorite part about APHA.
Yeah, and it's nice being at Insulet now and working for a product like the OmniPod 5 and getting to speak to all of of these different pharmacists, because they all have a different perspective on the product and they all have a different experience with the product too. So it's really interesting to hear all the different things.
So we were talking to Teresa Toll earlier, and I brought up OmniPod because of her diabetes programs that she does at community pharmacy. Dean, share with us the data that's available to pharmacists and physician teams around the OmniPod, and really how to dial into that when it comes to someone that's just starting with the technology.
Well, I assume when you say the data, you're referring to the data that can be actionable by an individual pharmacist.
Yep.
And Matt is, just as a little preview, Matt's here at the conference speaking about clinical data, the studies that we've released, but I'll certainly let Matt speak to that. But in terms of data available to individual pharmacists to engage with their patients, one thing that's really interesting and I think pretty cool about OmniPod 5 is that all the data that is created by the OmniPod 5 system, whether it be carb data, blood glucose data, insulin delivery data, is actually accumulated in the cloud on a de-identified basis to be able to understand how the populations are doing. And if a pharmacist or a physician wants to engage with that data, they can view that through Gluco and be able to see that so that they can see how their patients are doing on all those levels, all those components and pieces, and be able to see where they need to engage with their patients around that.
Matt, let's talk about that clinical data. So I'm a pharmacist. I'm in a community setting. I have, let's say, 20 patients that are on my OmniPod. What kind of data as a community pharmacist can I look at to make slight adjustments or slight coaching adjustments to maybe the diet of my patient?
For the diet of your patient?
Yep.
So by looking at their data, you can understand exactly how they're doing from their glucose levels and from the amount of insulin that's being given, and you can see how they're doing on a day-to-day. So you can use that information to, understand what kind of changes they should be making to their diet, because you can see the trends. Mm-hmm. It's just very nice to be able to have that data on hand.
And then that should be being shared back to the EHR, the electronic health record?
Yes.
And then what type of collaboration, what kind of adjustments are being made to a patient's lifestyle based on more macro data, bigger components of, let's say, a year's worth of data to be able to show trends?
Yeah, and that's what's really exciting about our real-world data. So now we have real-world data that we've presented in Type 1, and now just at ATTD recently, over the last week, we presented data in Type 2. So by seeing that long-term data, we're able to make adjustments and really understand in depth how the system is functioning for our patients. And so, like you said, more macro, right? What is happening over time for our patients, and how can we, make a difference?
Todd, one of the things that I was just thinking about as we were talking is I want to make sure that people understand, how this data that is available is so valuable, but how that gets accessed. I know we were talking a little bit about the EHR. The way that providers, whether they be pharmacists or MDs or nurse practitioners, the way they engage with our data is through the Gluco platform. Okay. And they can move that into their HR through their own processes, but we don't have like a global way to move it into HRs. So Gluco is the way that they access the data, but nonetheless, it's incredible data.
That's great. All right, so when I'm a community pharmacist and I know I have a diabetic patient, how are community pharmacists helping to coach a patient to utilize the OmniPod? What introductions are being made? What's the best way to present that to a patient?
Yeah, I think the first thing is, I think that there's a lot of opportunity for community pharmacists to further engage with our technology, and I believe that that's a tremendous opportunity as we go forward. But no doubt, community pharmacists who, front door healthcare, we know that they're seeing these patients quite often, and they know when their patients are struggling with their insulin, whether that's because they're not feeling as often as they should be, or they're communicating that they're struggling. And I think just the community pharmacists recognizing that there's this evolving technology, automated insulin delivery that's out there in the space, and that's maybe a better way for that patient to get their insulin and get improved outcomes, and just initiating that conversation, learning about the technology first, but then initiating that conversation to make sure patients are aware they have these options.
Absolutely. Matt and Dean, I appreciate you with your updates from OmniPod here at the APHA's post show, and we have to have you back on an upcoming podcast series to really dig into this.
We hope you're enjoying the press coverage of APHA's annual meeting. It's time for a pharmacy pop quiz. Do you know the Greek word for pharmacy? We'll give you a second to think. Time's up. Think you got it? If you said pharmakeia, then you'd be correct. For those of you who didn't get it right. Well, we're not sponsored by Duolingo, but you might want to get that streak going again.
My friend and fellow podcaster, Dr. Marcy Strauss, is back on the pods with me. Marcy, it's so good to see you.
So good to see you, too, and so excited to be back and at APHA in Nashville.
Nashville is really different now than what I remember it, 15 years ago. I always say it's just cleaner than it was when I remember, and it's more fun, and there's more going on in the downtown. So I think this is a really good venue.
Absolutely. Yeah, I think the last time I was here was about 6 years ago, and walking down on Broadway, and there's a brand new building, there's a big food hall across the street, and I think my days of kind of staying out super late and hitting all the honky-tonk bars are maybe a little behind me, but it's always a fun scene with love live music and just kind of reconnecting with so many different people too. So it's been a really fun weekend.
There's been a common theme here at the APHA this year, which is the word that I'm going to center on is inspiration. And being able to cultivate inspiration in a profession that has been beat up tremendously hard over the last 10 years. And this year, 2025, from my perspective, being a reporter, paying attention to every sector of pharmacy, I see a surge of innovation and I see a surge of hope, which I think comes from inspiration in of itself. So talk to us about your experience here, things that you're picking up that are inspiring, and also let's center in on the independent community pharmacy.
Yeah, and I love that the theme is igniting inspiration, because actually just a year ago I served as president of the Maryland Pharmacists Association, and my presidential theme was inspire. And when I think about what has shaped my career as a pharmacist and what I always get out of events like this, I always walk away feeling inspired. I want to try and inspire others, whether it's in my day job as a pharmacist or even just in life, because I wouldn't be where I am if I hadn't been for those in my life and making an impact. So I want to be able to make an impact to others. And actually just came out of the general session, and they were talking about, and the speaker was amazing, and talking about purpose and inspiring others, and said, purpose isn't just what we do, but it's the impact that we have on others and how we make them feel and kind of what we leave behind too. And it was really resonating. So when we think about the future of pharmacy and pharmacy practice and what I do in my role at Pharmacy First as manager of clinical operations or whether I'm in my role as MPHA or different hats, is how can we help inspire pharmacists, and especially in these challenging times? Yep. And it can be so easy to kind of get bogged down in just the day-to-day, but how can we tie into those interests and passions and really empower our teams, empower our pharmacists? And in my role at Pharmacy First is really working to empower our pharmacy teams, our members, so they can take their practices to that next level and really help them thrive and diversify those revenue streams and clinical services. And even beyond that, with my role at MPHA, is how can we inspire our members, that next generation of pharmacists, because that's the future of the profession, and it's exciting, and that's why I always love coming to these different meetings, and it just gives me some different ideas, and a lot of it's just a shift in mindset too, and just what's a different way that I can approach something, just a new way of thinking about it. I think is really exciting.
It is. I like the systems that are supporting community pharmacy, independent community pharmacy, allowing them to have their personality and do things the way that they want it. It's a private business. They can do whatever they want to take care of their own community. But now Pharmacy First is building infrastructure for them to do that easier than having to do it completely on their own. So talk to us about a couple of the programs that have really caught fire and have been helping pharmacies thrive.
Yeah, and something that we've been focusing on at Pharmacy First is, to your point, really building that foundation and infrastructure to support our pharmacies with diversifying those revenue streams outside of the dispensing area. Because even in the past 12 or 18 months, really seen a change as far as the different types of clinical services and programs that are being offered. And there's different buckets. Like, yes, there's the whole medical billing and credentialing, and there's a lot you have to go through there. But we're seeing an increase and more opportunity for pharmacies to get paid in platforms they already have access to today. And so it's a lot easier for them to get started, but it's all about empowering them with that information and helping them know, like, yes, your community is unique. Your needs are unique. There's these different programs out there. How you implement them and really how you succeed is going to be different for each one, but helping them really each step of the way to say, yes, we're going to help you identify what are those opportunities on the table. How can you make the most of those opportunities? How do you integrate that into your workflow and really be successful? Because we understand, like, yes, like, you are going to be different than the store down the street. And, as an organization, you're independent for a reason. We're not going to tell you how to run your business, but we're going to be here to support you and to empower you and hopefully inspire you too, because change is hard and we're so used to doing things a certain way. But, as these changes come along, like, we have to adapt. We have to be adaptable to really succeed. So it's kind of meeting pharmacies where they're at, but at that same time, hopefully getting them excited, helping them feel empowered, and they're like, yes, I can do this. It's like, what interests me? How can I really take that and apply that to my practice?
That's awesome. Hey, thanks for being part of the post show and spending time with me. It's always great talking to you, Marcy. Thank you.
Yeah, always great. Thank you, Todd, for having me.